Capsulitis. What is capsulitis? Capsulitis, by definition, is inflammation of a ligament. Anywhere in the body where two bones come together they form a joint, that is what allows movement within the skeletal system. Your ankle bending up and down is movement of a joint. Surrounding the joint are the capsular ligaments, which act to keep the two bones lined up in approximation so that the joint can function in its optimal range. Ligaments are very tough tissue, almost leather-like in texture. Capsulitis is overstretching of the ligament on the bottom of the foot. What causes capsulitis? Activities such as stooping while gardening, constantly climbing ladders, doing work low to the ground like electrical or plumbing work. Sports activities such as running, where there is a constant excessive bending of the toes at the level of the metatarsal heads. Walking barefoot, quite often, may also create this problem. Shoes wearing very high heel shoes. This causes a constant bending at the level of the metatarsal heads which can allow them to overstretch. Flimsy shoes like flip-flops or ballerina shoes, the constant excessive bending of these toes will eventually cause the ligaments to overstretch, become inflamed, and then begin to hurt. Foot architecture, the way your foot is structured, can make some people more susceptible to this condition. Diagnosing capsulitis. Typically a patient will present to the office complaining of pain in the forefoot, probably not relating any specific history of trauma, but the pain is just an ongoing nagging type pain. Many times the patient will have neuroma type symptoms, which can be mistaken for capsulitis. Sometimes, but not always, an X-ray may be taken to rule out a stress fracture or possible arthritis within the joint. In most cases, pressing with your thumb at the level where the toe meets the metatarsal head, pain will be felt. Treatment of capsulitis. Cortisone injection should help this condition. Sometimes upwards of 3 injections over a course of 3 to 6 weeks may be necessary to quiet down the pain. Oral anti-inflammatory medication for a short duration only. Shoe selection: avoiding high heels along with boat shoes, flip-flops or any shoe with very flimsy soles should also help as well. Reduction in certain activities: avoiding activities which seem to exacerbate the problem. If you do not eliminate the activities that are creating the problem, then the chances of this condition clearing up, even with medical intervention, is drastically reduced. Orthotic with metatarsal pad: in individuals where the pain improves but does not go away many times, I will put them in prescription orthotics with a built-in metatarsal pad that basically lifts the metatarsal bone so there is not so much stretching of the plantar capsule as the patient walks. Immobilization: wearing a surgical shoe or use of a cam walker keeps the toes from bending, and over the course of a few weeks can result in the resolution of the problem. Surgery: people that have rigid hammer toes are more prone to this condition because the nature of the hammer toe deformity itself stretches the ligament. In these cases, if all else fails, surgical correction of the hammer toes can be very rewarding. Read the full article at www.foot-pain-explained.com/capsulitis.html.